Good morning. My name is Kendra and I'm going to be your nurse today. As we prepare for discharge, Dr. Brown wants to change you from your current medication of Coumadin to a new medication called Eliquis. We're going to talk about this medication. It's also known as apixaban. It's used for treating atrial fibrillation, which you have a history of, which is the same reason you were taking the Coumadin, but he thinks this is a better choice for you. It's important to note that you do not stop taking Eliquis without talking to the doctor who prescribed it for you. Stopping Eliquis increases your risk of having a stroke due to your history of atrial fibrillation, so be sure you keep that in mind. You'll no longer have to make the weekly trip to the doctor's office to have your INR checked with this medication. So that's going to save you some time, some gas money, all those good things. So that's one benefit of changing your medication. Most Medicare plans do cover the cost of Eliquis. However, if you have any challenges, ask the pharmacist or call back and let us know, because sometimes there's cheaper pharmacy cards or coupons out there, because a generic version of this medication does not yet exist. So if you have any problems or challenges in getting your medication filled, please just call us back or let us know. We'd be glad to help you. The doctor has ordered for you to take this medication as an oral dose. So you'll take it as a pill by mouth. Take it exactly as he's prescribed it, which will be printed on the bottle, which is going to be twice every day. You can take this medication with or without food. Just be sure you do not change your dose unless the doctor tells you to. If you miss a dose of your Eliquis, take it as soon as you remember, and do not take more than one dose at the same time. However, if you're ever unsure if you should take the missed dose or not, please call the doctor's office and we will let you know. If you're taking Eliquis for atrial fibrillation, which you are, stopping Eliquis may increase your risk of having a stroke. So it's important to keep up with how much Eliquis you have. Do not run out, and make sure you get your prescription refilled before you take that last dose. Whenever you're going to have any kind of medical procedure, go to the dentist, anything like that, or surgery, your doctor may tell you to stop taking Eliquis prior to the surgery. Only stop taking it if he tells you to, and he will in turn tell you when to start it back again. So that's just something to remember. If you're going to have a procedure, tell the doctor who's going to be doing it, or the dentist or practitioner, whoever it is, that you do take Eliquis so that he can be sure to let you know what to do in preparation for the procedure. Also, because Eliquis can cause increased risk of bleeding since it is a blood thinner, be sure you use a soft bristle toothbrush, that way your gums don't bleed. Use an electric razor for shaving to decrease risk for bleeding as well. And you may bruise easier when you take Eliquis, so just keep that in mind. There are some common side effects to Eliquis, such as bleeding, which we kind of talked about. Because it's a blood thinner medicine, it reduces blood clotting, which is what you need for your atrial fibrillation. Also, you might be at a high risk for bleeding if you take some other medications with Eliquis. So we don't want you taking any extra aspirin, any extra non-steroidal anti-inflammatory drugs, which are also called NSAIDs, but like the aspirin, the ibuprofen. Don't be taking any of that. Be sure to, like I said, stop your Coumadin. This is to replace your Coumadin, not to take in conjunction with. So let's just make sure we don't take any more of that. We won't take heparin, and there's a few other drugs that can cause interactions and make your bleeding higher if you take Eliquis. So make sure any doctors have a full list of your drugs. And I'm going to make sure that the doctor's taken a good look at your MedRec and reviewed it to make sure there's nothing you currently take that'll interact with Eliquis. And like we said, you may bruise more easily, and it may take longer than usual for you to stop bleeding when you're taking Eliquis, so just be aware of that. There are potential serious side effects like bleeding, which we've hit on several times, or a reaction to the Eliquis medication itself. A reaction can cause hives, rash, itching, trouble breathing. If you get this reaction, it's usually going to happen pretty soon after you take the dose, and you're going to need to get medical help. If you have chest pain, chest tightness, sudden swelling, trouble breathing, wheezing, faintness, dizziness, any of that, you're going to need to get help immediately, so call 911. Some other reasons to call your doctor and get help right away is if you have these other symptoms which can be related to bleeding. Bleeding can present in a variety of ways. So we want to make sure we've talked about all these different things. So if you have unexpected bleeding, bleeding that lasts a long time, any unusual bleeding for you, if your gums are bleeding, you're having nosebleeds, any of that should be reported to your doctor. Any bleeding that's severe, uncontrollable, needs to be reported to your doctor. If you have red, pink, or brown urine, that could be indication of bleeding, or red or black stools. Now that's going to look like black tarry stools, so make sure you let the doctor know about that as well. If you start coughing up pure blood, or any vomit looks like coffee grounds, can also be an indication of some sort of bleeding. So we need to know about that as well. Any unexpected pain, swelling, joint pain, call the doctor for it, or any headaches, or just feeling dizzy or weak. Anything unusual for you related to taking this medication, you need to make sure we know about. Do you have any questions I can answer for you before we get this going? And then we'll finish your discharge procedure and discharge teaching and get all that together for you. And also, we're always here. So if you think of any more questions, you can ask us. We don't mind.